Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, my name is Sandra. I live in Leicestershire. I was brought up in Leicestershire. I have a family of 5 children, 4 really because one died. And one of them, my daughter, we're quite close. She's very helpful. She does worry a lot. And my husband, he's my strength. He cares a lot for me. About 6 months ago, I wasn't feeling, well, 6 months before I was diagnosed, I wasn't feeling too good. So eventually I went to my own GP, and she sent me for some tests, urgent tests. And after all the tests, I had to go 1 week to my GP and have a ECG, and then I was called into a surgery and they told me that I'd got a tumour as well as blood clots, and that they'd have to start treatment straight away. I was diagnosed on the 25th of November 2011.
Well, Sandra, thanks for coming in today to share your story with myself and the viewers here. This is the Cancer Story video diary program.
Yeah.
And you know the purpose is to try and share your experience of what you've been through so other people can benefit from it.
Yeah.
I appreciate you coming in. Why don't we start with how your diagnosis was picked up? Because it took a little while for you to be diagnosed, didn't it?
Yes, it did, yeah. But probably that was my own fault in a way. I should have gone to see about not feeling too well sooner. But I think 9 out of 10 people have always got that fear and they shy away from it.
I agree. I mean, sometimes when we know something's wrong, we don't rush to the GP, do we? Because we don't want to necessarily hear something that we're uncomfortable with.
Yeah.
So what symptoms did you have then in the early phase?
Well, I had shortness of breath, I did go out shopping. I used to be a very sporty person. And then suddenly I lost some weight and I didn't feel too well at all. And it was actually, my husband said, you need to go to the doctors. And I did go.
He felt he could see a change in you, I think.
Yes, yeah.
And you went to see your local GP.
I went to see my local GP and she ordered tests urgently, and there was some scarring picked up apparently. And then I waited and I got a letter to go back to the hospital to see a doctor. I was diagnosed with a tumour and blood clots, but I got very good treatment. Within 10 minutes of getting home from the surgery, 10 minutes after, a community nurse came round to see me and tried to put me at ease. But I must say I did sort of lose it at the beginning. I was so scared, not only of my own illness, but I'd got this awful thought of leaving my family behind.
It's always a big shock, isn't it, when you receive something like that out of the blue?
Yeah.
And a lot of those thoughts about what's going to happen in the future go through your mind initially.
Yes, they do. Yeah.
Did you feel that you received enough information and support at that time?
Well, yes, because it was coming up to Christmas anyway, and I'd got an appointment to go to another hospital to see an oncology doctor. And eventually I went to see the oncology doctor, and she said I'd be sent to another hospital. I was put in touch with a Macmillan nurse, and she'd got a folder full of information about cancer, very, very helpful and kind. Could get in touch with her night or daytime, and that was one hospital that I received care from.
So in many ways you did have good input from a variety of allied health professionals.
I did, yeah. From oncology right through to the psychiatric oncology and the team. And really, they've pulled me through it.
So what were the steps involved in your treatment after the diagnosis has been made?
Well, I was told that they was going to set up a plan to see what they could do, and eventually I went for biopsies, and I gather that they'd sort of looked at the scan and found out what sort of cancer it was, and I was told that they was going to let me have radiotherapy. I really didn't want to know the ins and outs because I was still really scared. But through the weeks I went for my radium treatment. I'm not going to say it was easy, but it did apparently help to shrink my tumour, and also it got rid of my blood clots. And then of course I had follow-ups. I was still a bit scary, but with all the help I had, it did help me, and I can't thank people enough. You do feel frightened, but I think some of the fear is took away if you get the right care, which I did.
A lot of the time it's about knowing somebody's there to help you.
That's right.
Who you trust and you believe can make a difference.
Yeah, faith.
And it's good that you came across those people in your case.
It is.
Now you had the radiotherapy, and it wasn't necessarily straightforward. It wasn't necessarily easy.
No.
What were the main side effects you had?
Well, it's probably due to where the tumour was as well. I had.
You want to tell people about that?
Very tired. My tumour.
Where was it?
My tumour is at the top of the right-hand side of the lung, where I did develop blood clots, and I had to have injections to get rid of the blood clots and, well, give me some more time if you like. But the radiotherapy apparently has shrunk it a bit. Having radiotherapy was a bit traumatic, but deep down you think, well, you've got to have pain to cure pain. I used to get very, very tired, and I couldn't eat properly. I used to have to go on special drinks so that I could get the nutrition, and finally I started to eat more solids, and they said I did cope with the radiotherapy very well.
What was it that was impacting upon your eating?
It was just I couldn't swallow.
It was inflamed in that area?
It was very inflamed, yeah, and my throat, and that was sort of closing, but you just learn to sort of get on with it, you know.
So initially you had to adapt your diet?
That's right.
To more liquids and semi-solids, I think?
That's right, like custard or rice pudding, you know. But eventually you start to pick up and eat more solid food.
After how long would you say? Because some people will be in that situation and they want to know.
I'd say it took me about a good month. Yeah, a good month.
Now you had to rescan, I think, and then it was shown that you had improved in some ways.
Yes, it did. Although I was frightened going for the results of another scan, I sort of, they put the picture up on the screen and I'm closing my eyes and saying, turn it off, I don't want to see it, you know. And they just explained that they were very pleased that the tumour had shrunk and also that my blood clots had gone. And it was a big relief. Although they did explain that I can't have any more treatment, the cancer won't go, but they've tried to give me extra life, which they have.
And how do you feel about how it's been left for you with that level of information?
Well now, funnily enough, the last appointment I had with the oncology doctor, I was brave enough to look at the screen. Not showing everything, but where he explained about the cells and that, I was okay.
Were you able to see the area that was affected on the scan?
Not fully. It wasn't as clear as it was when I first seen the tumour.
Maybe that's a good sign that it wasn't as manifest on the scan,
that's
meaning
right.
that it was shrunk to some extent.
Yeah, that's right. But I'm glad I eventually did go to my GP, and I do get my moments where I am a bit frightened, but I wake up every morning and thinking, another day.
So in some ways you're looking towards the future in a positive way now.
Yeah.
What do you think's helped you come to that sense of positive outlook?
Oh, the care really, and then you see other people. I mean, I can't help it, but when you go down to oncology, you see people much worse than you are yourself, and you willing yourself to help them, and you feel sorry for them, and you actually have a little tear, you know. But
what's your reaction to seeing people who are more unwell? Do you feel that In some ways that can help you, or do you feel afraid you might be in the future in that position?
Well, I am afraid I might be in that position, but I've also had to look after my mum and my brother who had cancer, and I had a daughter who died with cancer, and probably this is amounted to a certain fear that you do know what's...
Well, you've had a lot of experience with cancer. Can you tell people what your family members suffered, particularly your daughter?
My daughter suffered stomach cancer. She was 37, and apparently it was a rare form of stomach cancer, and in the end it just spread all over and she died. But it was a blessing because she was really suffering.
How long did it take, all that process, because she had the cancer very young?
Yes, I'd say she went to hospital for a year, and they kept saying nothing was wrong, and then she wanted a scan, and they gave her the scan, and that's where she got diagnosed. But she had the Macmillan people in, very, very good. She had very good care.
How long did she manage to fight the cancer for?
About a year. Yeah.
And your brother, I think you said?
Yeah, my brother, bless him, he was an ambulance driver, big strapping man, different to me, 6'2", 15 stone, and he used to do a lot for charity, cancer charity, baby unit charity, and I got a phone call one morning, and it was one of his neighbours asking me to go up because he couldn't breathe. So I left everything, went up, and apparently he'd been doing a charity boat race thing, and oddly enough I never knew it, but he couldn't swim and he ended up in the river. And as time went by, he was getting unwell, and he also went for tests, and they told him he'd got lung cancer. Well, I wanted to be with him when they told him, but that didn't happen, and he sort of hated everybody after that. But eventually he turned the opposite way, you know. But the care he got was good. I mean, the ambulance staff and everything, they used to come round to my house and look after him while I had a little bit of free time.
Did you feel that you were able to spend some quality time with him after he was diagnosed?
Yeah. But the only upsetting part about that was I wasn't there with him when he died. No. We were very, very close.
I'm sure he did appreciate you having been around and, you know, giving that support.
Because he wasn't my blood brother as such, because I was adopted when I was a child. So, but we were like real mates.
And I think you also mentioned one other person. I think you said my
mum, my adopted mum. Yeah. Well, that was many, many years ago, before, I mean, everything new, as you get now, came out. And where you had to pay, we had to ask if we could go and see a doctor, a private doctor.
Was this before the NHS came along?
No. And we went up to see, eventually we got a letter and you had to pay then. And we went to see a doctor up there at Stonygate Way. And after he'd seen my mum, he called my brother in, and he said that he wanted my mum to go into hospital to do some tests. Anyway, she went into hospital, and we went in to see her, and she said, quite casually, I've got to have my breast off. Of course, I was fighting back tears, trying to not let my mum see, you know. And it went from there, and she had her operation. The day she had her operation, we went in, and she was wide awake, The doctor came, can you put your head up, your arm up? She lifted her arm up, and she never ever did. She wasn't told that she had cancer. And I think really if she had been told, although I think deep down she knew, she wouldn't have lived for another 10 years.
That's really amazing, because in those days often the information, the core diagnosis, wasn't revealed to the patient.
No.
Often what they did was to tell a relative.
To first, yeah.
And then decide whether to tell.
We never did tell my mum. But we think that she knew anyway.
So the family knew, but she didn't know.
No.
At least she wasn't told. Whether she knew deep down. Most people would imagine if you then have to go for the treatments and everything, you would eventually find.
She didn't have radio. All she had was treatment in tablet form. And she had 10 more years, extra years.
I wonder what they used to tell her the tablets were for.
I don't know.
That always intrigues me back in those days. That's when we hear that story.
And she lived for another 10 years, and then she got secondary cancer and she passed away, which was a blessing. But her care was, in those days, I think that was good.
What do you think overall of the care given to people then and now?
Well, I think different people come across with different things, different treatments and what have you, you know. So I can only really comment on my treatment, to my brother's treatment, to my daughter's treatment and my mum's. But all in all, I would say to people, go to your GP, take the treatment. Of course you're going to be scared, you know, but eventually it does go away. Not entirely go away, but it does dwindle a bit.
Let's come on now to what you found that helped you. Because I think you've had your ups and downs as well along the way. Emotionally it's been difficult as well at times.
Yeah, but used to be a very, very strong-willed person, very sporty person. I'd help anybody. I've worked with elderly people, and if anybody is ill today, I would still give my support.
You've still got something to give back, I think.
To give back, yes. And you feel that you want to give back.
And that to me is a great sign of somebody doing well, when they've got enough reserves to want to give something back.
Yes.
Because you know that when somebody comes in afresh to this diagnosis, sometimes everything just seems negative.
That's right, yeah. But now I'm more positive.
So what's happened to help you along the way?
As I say, all the from my GP to the community nurses to the Macmillan nurse, although I don't see her very much now, but she's there if I want to my oncology doctor, the radiotherapy team, they was very good, and this psycho-oncology team. I think they have helped me a lot.
Well, that's kind of you to say, and I'm getting the message there that as a package, everyone together.
There is a package.
Helps all different angles.
And at first I felt when I was told that there was all different kinds of help I could get, I felt a little bit guilty, as if I was being a cadger, you know, but it was explained to me that it was my right to get help.
You thought you could have been being a nuisance initially?
Yes, that's right, yes. But I say to people now, no, get all the help you can.
Yeah, because to be honest, there's many people who still don't access the help that's available.
That's right. I know now, since I've been diagnosed, that I've had to help 2 people get help. You know, and I must say that they felt different again, because they get inner strength knowing that somebody is helping them. And I used to say, in another way, I was a coward. But now I think, no, you're not a coward, you know.
No, you've come through a lot and really fighting back in the best way you can, which is the opposite of being a coward, I think.
Yes.
So I wouldn't say that at all myself. Now, you have got some other source of immediate support around you in terms of family, haven't you?
Yes, I have.
Who do you think is your key contacts? Good key contact?
My husband is my key contact. I feel for him. Well, I think he's getting used to it more now, but he was feeling very upset about it. But we came to the conclusion, in his words, that we'd get through it together. And also one of my daughters, who lives quite nearby, she comes and helps me, and she gets worried, but we both share the worry.
I think if you can say as a family you're going to get through it together, it's a very valuable way to approach things, because you're all doing what you can then to try to beat it.
That's right, and obviously there are people who do get cancer who haven't got any family, and therefore I would say to them, let people help you. You know.
Now, the other side of that coin is family members often feel that their needs are sometimes overlooked, not by the main person with cancer, I mean really by the health services. When we're trying to help the patient so much, we sometimes forget the family members and carers' needs. But they sometimes can be struggling too.
Yes, my husband struggled, but as I say again, the care I received and the care he's received along the line, I mean, we go to COPE, and that was only through the oncology team, one of the nurses, ringing up COPE, and a lady from COPE came round to see us and asked as if we'd like to go, and we said yes. And we enjoy going to COPE.
What format is that in?
It's a group. People, not necessarily with lung cancer, but different forms of cancer. And we play bingo, we have a raffle, chat, cup of tea, biscuits, and I've really got to know them, you know. So
I think group therapy can be quite powerful.
Yes.
Because you receive the support from other people who've been through similar things.
Yeah.
But some people are worried when they perhaps are offered group therapy that how will I react to seeing other people with maybe different conditions or different stages?
Yeah, well, we all know that we're there, what is the word called?
Voluntarily? Yeah,
and also really COPE are helping in their way, you know, and every one of us know why we're there, no questions asked, we just, you know.
Would you say to other people watching you would support the value of groups?
Yes, I would. Yes. Yes, I would. And I also support one-to-one.
One-to-one's useful too.
Yeah.
Again, that can be formal or informal, you know, one-to-one with friends, relatives, one-to-one with healthcare professionals for a chat, general support, or more formal therapy. Each one has its place.
That's right. But I'm greedy because I like them all.
I don't think there's anything wrong with that. Like you said, it's best to get the support that's available.
It is very important.
Now, what about that? What about gaps? Do you think, realistically, looking at maybe other people's situations as well as yours, are there gaps out there that you've seen?
There are gaps. As I pointed out that there was, in fact, 2 people I knew have died and they didn't get any support. I had to sort of tell them, look, you're entitled to this, and tell them what to do through their own GP, and the hospital and that.
And given your extensive experience, not just with yourself but your family members,
Yeah.
can you think of a way how things could be organised a little bit more effectively for people with cancer?
The only way I think it would be effective is they made sure that this care was offered to them. Very important. That
So they make almost an offer to everyone
yes,
to check whether people are in need of help.
that's right. Yes, I mean it could be a busy time, but what's a busy time to a life? You know.
I guess that's a good point, that sometimes staff are very busy doing certain jobs.
Yeah.
They might overlook other areas which aren't their core area of responsibility. Obviously, from my point of view, I think of psychological and emotional issues,
Yeah.
but it could apply to other areas as well.
That's right. Yeah.
And we have to be careful, don't we, to avoid missing out on patients' needs, really.
Yeah, and another thing that whether this should be on, when one of my oncology doctors, I went for my scan and x-ray and had to see one of the oncology doctors. It wasn't till I was getting near the door that I found out she'd left. Now that did put me back. It was a bit upsetting, really.
I think I understand what you're saying. One of your clinicians
That's right.
had recently left the trust,
something. Yes.
and you saw one of the people that were filling in for her,
Yeah.
and then you were told almost at the last minute, well actually
Yeah.
after the
Got
fact,
to the door.
after the fact, that
Yeah.
this key individual for you, the consultant, had gone,
Yes.
and you weren't otherwise informed.
Yeah, but now I see another oncology doctor, and he's quite nice. I feel
You feel
safe
you've
and
got to
safe.
trust in him,
Yes.
and that's important because if you have trust in your clinician, you believe that they're going to find the right options for you.
Yeah. Yeah.
And you're more likely to follow their advice because you think, well, they'll give me their honest opinion.
Well, yes, although sometimes you don't want their honest opinion.
Actually, I was going to ask you about that because I think you've had a kind of a certain view about information and finding out about details that. Well, I'll ask you. I mean, what is your view about whether you should find out as much as possible, or only what you need, or as little as possible, and let the doctors get on with it?
Only what you need. Only what you need. And maybe in time like me, I've sort of gained courage and said, right, I'll go a little bit more and find out a little bit more information on my health.
Does that strategy work for you?
I'm more at ease now, but it's not to say that when I get to oncology that I'm going to feel the same, because you're always, I think, uncertain. You know it's incurable, especially.
Do you think in a way the more you come to terms with your situation, your illness, the more you want a bit more information, the more curious you are?
Yes, but I don't think I should say this on video. Curious, but I don't really want to be told how long I've got.
And that's fair enough. You're entitled to that. In some ways, good clinicians would ask you your preference
Yes.
for receiving sensitive information.
Yes.
And if you don't want to know, I can see where you're coming from, because many people would say, I want to just carry on the best I can, take one day at a time. If I knew too much, I might be always looking out for a negative event.
Well, that's why we didn't tell my mother, because we knew deep down she'd give up. And since I've been on my medication and that, I've put over a stone on, so I must be doing all right.
The other point of view on that topic is that sometimes we as the clinician don't actually always know in great detail what will happen. And we can be wrong too.
Yeah.
So sometimes it is not accurate information you get, and that can be misleading, and that's a problem.
Yeah.
But I have to say, for the viewers, that there's an opposite point of view as well, which is that if you really feel like you're in control of the situation and you're doing everything you can, sometimes people do want to have that information, and that it helps them sometimes plan for the future and make preparations. And even if somebody said to you, well, I'm going to tell you you've got a year left, just hypothetically, you can think to yourself in the back of your mind, that's what they're to me, but they probably don't know for 100%. I'm going to try to see if I can be that. Do you know what I mean? You can try to take a positive view even of something that seems initially negative.
Well, one positive view I took anyway, I know I can't fly again, but my husband and his friends found out about a coach trip going to Spain, and they asked me. I was a bit dubious, but for my husband's sake, and probably my sake, I thought, well, I'll try it. It was a bit tiring, but...
So you did that?
But I did that. I didn't think I would, but I did it.
You've introduced another area here, which is the importance of carrying out meaningful activities and maximising your quality of life, no matter what your situation. So you were able to look for opportunities and do those things, even though they were quite a challenge in some ways.
Yes, they were a challenge,
But I bet, tell me if I'm wrong, but I bet you got something out of going on that trip.
Yeah, I mean, there's memories, and what I got out really of going on the trip was that I didn't hold my husband back. We did that together, you know, which we didn't think we would at one time. But somehow you get that inner strength.
And what else have you been doing with that inner strength, you know, more closer to home maybe?
Well, my daughter, she was 50 2 weeks ago and helped out with the party, and I went to a party, and I think, although I get very tired, I somehow find the strength, say like I go to bed normally about 9:30, 10 o'clock, but if it's somewhere social, I do feel tired in one way, but I just say to myself, come on, you can do it, you know, and probably past midnight to 1 o'clock I get to bed on those occasions. So yeah, it's not all bad.
Is there anything new you've taken up as a hobby or interest since your diagnosis? Or restarted from before that you did?
No, not really. I just try and carry on as much as I can.
Do you have any interests or hobbies at home?
Well, yeah, I like reading a lot. I still do some of the cooking. I do the washing, and I still do some of the ironing. So
sounds like you've got a lot of jobs on around the house.
So sometimes you feel, you know, but...
Is it because you wanted to take those areas of responsibility back after you were unwell?
Yeah.
So you felt like you had that role again?
Yes, I actually felt guilty, because I didn't really. I know my husband's capable enough, but I didn't like him having everything put on him, you know. And I know when I've done enough, and, you know, I want to give it up.
Are you able to still ask him for help when you need it, though?
Oh, yeah.
It's important to know your limitations, isn't it?
Yeah, it is important. But it's more important as well not to sit still, if you can help it.
Let's talk about the future a little bit, if you want to. What spot do you see in the future for yourself?
Well, up to now, I see in the future that, okay, probably things will change, but I don't feel at this particular time that they're going to change, that I can carry on until that change comes.
So you feel that there's things you can still achieve?
Yes.
That's definitely a positive, isn't it?
Mm-hmm. Yeah, you've got to be positive.
Are there any things you've got planned coming up?
Yes. We've got my 71st birthday party coming up, and we've got in April 2013 we've got a boat trip to Holland, a tour around Holland coming up.
Wow, that's excellent.
So be strong for that.
There's things to look forward to there.
Yeah.
I think it helps, doesn't it, to have things to plan for in the future.
Yeah. Yeah.
So I think, Sandra, that everything that you've been through shows that you do have a strength to face all these challenges, and that you have managed to fight the cancer as much as you're able.
It's been hard. I won't say it's been easy, but the determination has been there. I mean, okay, you don't have a good day every day. I don't think it's a do to have a good day every day.
No, and you need to know how to tackle those bad days as well.
Bad days. Yeah.
So we can't pretend everything's 100%, but
No.
the fact is you're doing the best you can. You've got your quality of life back to a large extent. You're making plans for the future. And you're going on assuming that you've got an appreciable time left, no matter what the future holds.
And really, I am a very lucky lady, because I could have left it too late. So I just say to people, go get help.
In terms of that initial diagnosis, go even if you're nervous about it.
Well, that's right. Yeah, I don't think anybody's been more nervous than I've been, but you do, as I say, you get that inner strength and you say, right, I will do it.
Yeah, that's good advice. And do you want to give people any other specific advice?
Yeah, I'd just say, well, face it, talk about it as much as you can, accept the help that you're offered, and even if you're not offered, just ask about it.
That's brilliant advice, to ask, even if you feel there's nothing been spontaneously offered to you. You can be proactive and ask for help if you need it.
Well, that's right, because it's another sense of getting well.
Good. Well, I'm very pleased you came in today and gave us your account. I think it's very helpful for the viewers and myself to hear what you've been through, and I'm touched by those mention of your family members who've had the cancer as well.
Yeah.
I know that that's not always been easy for you.
No, it hits you both ways.
And I'm glad you've got your husband around to support you as well.
And if this video can help others, well, I'd love it.
That's the aim. That's the aim. Thanks very much then.